In July of 2020, the U.S. Department of Veterans Affairs and the U.S. Department of Defense published an update of the clinical practice guideline for non-surgical management of hip and knee osteoarthritis, which had last been updated in 2014. The authors of this synopsis are all members of the work group that developed the full guideline. 19 recommendations formed using the grading of recommendations, assessment, development, and evaluation, or GRADE system, were included in the guideline. These recommendations cover the subject areas of diagnosis, self-management, physical therapy, pharmacotherapy, orthobiologics, as well as complementary and integrative health, dietary supplements, and nutraceuticals. I'm Adam Edward Lang from the McDonald Army Health Center at Fort Eustis in Virginia. Along with authors Anil Krishnamurthy, Sanjo Pangarkar, Jess Edison, John Cody, and James Saul, our article entitled Synopsis of the 2020 U.S. Department of Veterans Affairs, U.S. Department of Defense Clinical Practice Guideline, the non-surgical management of hip and knee osteoarthritis, will appear in Mayo Clinic Proceedings.
I'm Anil Krishnamurthy. I'm the Chief of Orthopedics here at the Dayton VA and one of the VA champions for the Clinical Practice Guideline. One of the questions was, how does this finding relate to clinical practice? The guideline plays a major role in providing primary care team members with the most up-to-date resources to manage their patients with hip and/or knee osteoarthritis. This is especially within the VA and DoD settings, where the activities that place patients at higher risk for osteoarthritis are an integral part of the daily duties of many who serve or have served in the U.S. military. The guideline is evidence-based and therefore provides primary care providers with up-to-date treatment options in managing their patients, all in one place. The guidelines also are arranged in an algorithmic fashion to help in a stepwise management of patients with osteoarthritis of the hip and knee.
This is Jim Saul. I will provide an overview of the recommendations that we found in this guideline. After reviewing the evidence, we were able to make 19 different clinical recommendations, and those recommendations fall in the categories of diagnosis, self-management, physical therapy, pharmacotherapy, orthobiologics, and then complementary and integrative health. So to begin, we found that MRIs are not valuable in making the diagnosis of osteoarthritis. They may provide help later on when making certain management decisions, but when it comes to making the diagnosis of osteoarthritis of the knee and the hip, an MRI does not provide any value. Those diagnoses can be made either symptomatically or based on a plain film. Next, we had some self-management recommendations, and we found that for appropriate patients, weight loss is valuable. Exercise and bracing can also be very valuable for these patients. When you think about medications to treat these patients, the mainstays still have evidence, and those would be the non-steroidal anti-inflammatories and or acetaminophen. Those two particular agents still have evidence that they can be effective in managing pain. We also did find evidence that topicals can be valuable as well. These would be topical NSAIDs and topical capsaicin. Now we found evidence that they work well on the knee, but we didn't find that same level of evidence for the hip. And we would assume that that is because of the level of tissue penetration that would be required to get benefit on the hip. But we did find that there is evidence for valuable pain management with the knee. Also, we found that duloxetine can be a valuable alternative or perhaps an adjunctive to acetaminophen and or those NSAIDs. As far as opioids go, we do not recommend using opioids to chronically manage pain in patients with OA. There may be some indications to use these on a very short-term basis to control their pain, but that needs to be used judiciously and with great caution because there are definite harms associated with long-term opioid use in these patients. Orthobiologics, interestingly, we did not find a lot of evidence to support the use of these agents. And these agents would include platelet-rich plasma and stem cell injections. Now, another area that's hot on people's minds might be complementary and integrative health interventions. Unfortunately, we did not find a lot of evidence to support the use of these interventions either. Now, these would include dietary supplements and nutraceuticals. The nutraceuticals, you're talking about agents such as collagen, glucosamine, CBD oils, vitamin E and D, chondroitin, and there's a much more extensive list in the guideline itself. But none of these nutraceutical or supplemental agents had evidence that we could find. Also, the evidence did not support using acupuncture, massage, tai chi, or yoga. And then there's a more extensive list of those types of interventions in the guideline as well either. And then interestingly, we didn't see a lot of evidence of benefits with the use of TENS on the knee as well either. And that wraps up my summary of the findings that we had.
Hi, everybody, and good morning or good afternoon, wherever you may be. My name is Sanjo Pangarkar. I'm a doctor here practicing pain management in Greater Los Angeles, VA. I'm going to discuss a little bit about patient education and patient benefits from this guideline. The guideline really provides patients a roadmap of the potential treatments for their disease, as well as many of the tools for self-management for osteoarthritis of the hip and knee. The guideline stresses non-opiate management of pain and emphasizes exercise and other lifestyle changes in the management of their disease. This guideline will also help primary team members better assess their condition and determine optimal treatment methods, improving quality of health and health outcomes, as well as minimizing preventable complications and morbidity. We also stress the importance of a patient-centered biopsychosocial approach when utilizing this guideline. And hopefully it'll be very valuable for patients to have discussions with their providers when they actually have their appointments. Thank you.
What is the next step for this line of research? We have identified several areas of where improvements in the evidence are needed. There was an overall lack of quality evidence throughout the topics covered in the guideline. Research priorities that we suggest are long-term effectiveness and safety studies greater than 12 weeks in length, comparative effectiveness research of both pharmacologic and non-pharmacologic options, optimal timing for the delivery of physical therapy services within disease progression, and further, safety and efficacy trials for orthobiologics and other emerging biologic treatments.
We encourage you to read the synopsis of the guideline to help improve the care of patients with hip and knee osteoarthritis using the most up-to-date evidence.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.